Dr. Hanna-Attisha was a pediatrician who refused to let a city's children become quiet casualties. This is the story of Flint, Michigan, a Midwestern city whose water became the center of a modern public health and political scandal between 2014 and 2016, with reverberations that lasted for years. In April 2014, the city of Flint, under a state-appointed emergency manager trying to cut costs, switched its source of drinking water from the Detroit-supplied Great Lakes system to the Flint River. The decision was sold as short-term and economical. What followed was a chain of technical failures, ignored warnings, and official obfuscation that would unfold into a public health catastrophe. Within months, residents complained about foul smelling, discolored water, and rashes, pipes corroded. The Safe Drinking Water Act required corrosion control treatment to prevent lead leaching from old pipes, treatment that was not applied. State regulators and city officials repeatedly assured residents their water was safe. Tests were released that suggested compliance. Yet independent researchers and whistleblowers were already raising alarms. Mark Edwards, a water engineer from Virginia Tech, began bringing bottles of Flint water back to his lab. His team found lead levels and bacteria that contradicted official claims. Inside the EPA, Miguel Del Toro, a drinking water specialist, flagged the risk and urged action. His warnings were sidelined, and his early memos were ignored. The pattern was not just incompetence. It had the shape of a cover-up, officials minimizing results, changing testing protocols, and insisting the water met standards even as evidence mounted to the contrary. The turning point came when Dr. Hanna-Attisha, poring over pediatric records, discovered a steep rise in blood lead levels among Flint's children after the switch. In October 2015, she went public with data showing that the proportion of children with elevated blood lead levels had jumped notably. Her study galvanized public outrage. Suddenly, the crisis could not be dismissed as isolated complaints or bad luck. As scrutiny intensified, documents and internal emails leaked. They revealed that state regulators had been warned about corrosion control requirements and the risk of lead exposure, yet failed to act. Tests had been designed in ways that understated the problem. The Michigan Department of Environmental Quality defended its guidance for months, despite mounting evidence to the contrary. Meanwhile, Flint suffered more than lead. Between June 2014 and September 2015, the city experienced a Legionnaire's outbreak, with dozens of cases and at least a dozen deaths linked by public health investigations to changes in the water system. The human toll, neurodevelopmental harm to children, chronic illness, and deaths made the stakes unmistakable. Public pressure forced change. Flint was reconnected to the Detroit water supply in October 2015. In January 2016, both state and federal emergencies were declared. Investigations followed, federal and state inquiries, lawsuits, and criminal probes. The narrative that emerged combined technical failure and political calculus, decisions made to save money, warnings put aside to preserve that decision, and communication crafted to reassure rather than protect. The conspiracy at the heart of Flint was not a shadowy cabal, but a cascade of institutional choices and denials of failure to prioritize human health over budgets and appearances. The story exposed how regulatory capture, bureaucratic inertia, and political expediency can transform a civic utility into a vector of harm. Years later, Flint's recovery remains incomplete. Pipe replacements continue, children's health continues to be monitored, and accountability has been slow and uneven. Dr. Hanna-Attisha, Mark Edwards, and others who spoke up changed the arc of the crisis by insisting on transparency and science. Their work reminds us that truth in public health is an act of resistance against silence, against spin, and against the calculated decisions that can poison a community's trust.